Hi Donna, this is Kim, and I'm going to be performing the inserting of the urinary catheter. Okay, as you know, I'm doing a repeat, just focusing really on my sterile field, which I've really been trying to do better on. So my kit has already been opened, which you said was okay. Okay, first of all, I would have washed my hands. And good morning, Mrs. Smith. How are you this morning? And I'm going to check the ID band on the patient. Okay, Mrs. Smith, my name is Kim, and I'm your nurse, and I'm going to be inserting a urinary catheter into your bladder, being you're having trouble voiding after surgery yesterday. Okay, so I would have washed my hands like I said, and then I would perform any type of pericares needed before this procedure. So anyway, all that would have been done. Okay, now here's my sterile kit. I've already thrown away the hard plastic that it was in, so we'll just pretend here. And just bear with me because it's not wrapped, perfect. But here's my plastic bag, which I will use for a garbage. And I'm just going to set it on the chair over here. Okay, now I'm going to start unfolding this kit here. Always folding away from you. Okay. Oops. There we go. Alrighty, I'm going to pull this up here. Get it tucked under the patient's legs as well as I can. Not touching any of the equipment in here. Okay, here are my sterile gloves, which I will be putting on after a minute here. Okay, now I'm nervous. This is the blue sterile field, and best thing to do is to open it, touching just the very corners, holding it in, tricky, not touching the sterile inside of the field, and then just laying down, making sure you don't touch anything. Okay, now I can adjust that once I have my sterile gloves on. Okay, so at this time I'm going to be putting on my sterile gloves, which I don't have my sterile gloves anymore, but you did see me do them on the previous video, so I'm just pretending here that I have sterile gloves on. Okay. That in my garbage. All right, now here is my tray, and at this time too, I'm going to pull this out a little bit, and then I can go in and making sure my hands are above my waist always, and I can just tuck this in, tuck it in next to the patient. Okay, not touching anything other than the sterile field with my sterile gloves. Okay, now I am going to bring this in a little bit closer, still not touching anything outside of the sterile field, and then I am going to remove the tray over here. And this piece of drape cloth we don't need, so I will dispose of that. Okay, we don't need the specimen cup, so I will dispose of that also. Still maintaining my hands above my waist. Okay, let's see here. Now, this is a cath strip, which I will lay over here too on the table. Okay, my betadine swabs are right here. which I will, I really hate to open them just because in case I have to do this over, but I will open them. And hopefully I don't have to do this over, Donna. Okay, I'm going to remove them from the package and just set them in the tray here. Setting that down there. Not touching any of the garbage. Okay, my lube. I'm going to open up this lube. Boy, maybe. Oh boy. Figures I'd have to have trouble with it. Okay, there it comes. Alrighty. The lube in the tray. There we go. Disposing of that. Okay, now at this point now, my hands are still sterile, which they need to be. I am going to, before I do this, I'm going to test my balloon. Okay, so the wrapper is off of this, yes, because I used it before, but it comes with a plastic sleeve, which I would take off. I pull off the end, dispose of it. Okay, always hanging on to the catheter end because you do not want it to touch any part that's non-sterile. Okay, so now I am going to take my water here and test the balloon. Inserting five cc's. Okay, and the balloon is working fine. Now we'll draw that water back out, but keep the syringe attached. And you always want to check the catheter. You always want to check the manufacturer that makes the catheter, because some of them don't require you to test the balloon. Okay, so now at this time I am going to lay that back down, keeping it inside the sterile area. Okay, now I am going to take my left hand and hold on to the labia, pulling it upwards and back so I can have a good view of the meatus. Okay, and at all times my left hand will stay on the labia. Okay, I'm going to take one swab and go down one side of the labia majora, bringing my swab out and around, not crossing the sterile field. I will lay that, I'm just going to lay it down in there in case I have to do this over. So I'm going to take a swab, the other swab, and come across and do the other side of the labia majora, bringing the dirty swab out and around towards me. Okay, not touching anything still. And then my last swab, I'm going to go right down the center on the meatus. Okay, bringing the swab out and away from the sterile field and not crossing the sterile field. Alrighty, I'm still hanging on to the labia with my left hand. And at this point now, I am going to go 3 to 4 inches down, lube the end of the catheter, and then I will start inserting the catheter 3 to 4 inches. Always watching the patients for facial expression, any grimacing. If there would be any pain that they are experiencing, that means the catheter is in the urethra. So I would need to start over. Okay, the catheter is in 3 to 4 inches, and I am seeing clear amber urine. So now at this time I can bring my left hand down and hold right here on the catheter, And now I am going to insert, the catheter got a little twisted up here, but I'm still maintaining my hands at my waist and not touching anything other than the sterile field. Now at this time I will insert the water into the balloon. Okay, and still checking with the patient, making sure they are not experiencing any pain. Okay, and I'm going to also check for placement of the balloon by just tugging on it just a little bit gently. Okay, now the water is inserted. I can let go. I'm going to come down and hang on to the catheter and take the syringe off, let go, put the syringe there. Now, at this point now, I can, not touching the clean catheter bag, everything's inserted. Okay, and now I can, oh there's my sleeve, I didn't see it. Now I can wrap everything up, remove it off the bed, and over here, I'll be taking off my gloves and putting on new gloves. Okay, now I'm just going to continue to fold up the sterile field, not touching the inside, just the outside with my gloves. So all the sterile is done. Okay. Are you doing okay, Mrs. Smith? Alrighty. Okay, now I'm going to bring this over across Mrs. Smith's leg, and then I have a cath strip here which I would open. I'm not going to open it right now, but you can attach it to their leg and attach the Y to their leg with the Velcro. And then I would bring the tubing down, or the cath bag down along with the tubing, attach the bag to a non-movable side of the bed, and make sure the tubing is all coiled up and left on top of the bed and just the bag hanging. Okay, also, yeah, I would cover Mrs. Smith back up, making sure she's comfortable, and I would also at this time I would remove any betadine and do pericures again just to get rid of that betadine and make sure she's comfortable. Okay, I'm going to remove my gloves because I did pericures, and I would adjust the bed to the position it needs to be in, the height of the bed. Also the head of the bed, adjust the head of the bed so she's good. Mrs. Smith is comfortable. Make sure the call light's in reach. Let her know that I would be back in about half an hour to 45 minutes to check on her. And I would also check on the catheter and make sure it's flowing good without any problems. And after I was done, I would, after I leave her room, I would go back and do my dark charting. And I think I covered it all. So hopefully I did a good job this time and didn't cut across any of my sterile field. Anyway, okay, thanks. Have a great day. And I did lock up my cat this time, so okay, thank you.